everybody. I am 48 hours out from my extractions. Talking a little bit better now. Sorry about the background noise, but single mom life never stops. So we got some Peppa Pig in the background there. But anyway, I wanted to talk about extraction day and just kind of describe what it was like and what I went through. I came in the morning to get my impressions done, and that went well. And then I had 4.5 hours to wait. I did not go home. I actually stayed kind of in the area. There was a Walmart nearby. I went to the Walmart and I got my prescriptions filled so that I wouldn't have to stop anywhere on the way home. And I got a couple of snacks at Walmart, and then I just kind of sat in my car playing on my phone. I tried to take a little nap, but I just couldn't seem to. Anyway, I just, the hours went by. I talked to a few people. I had my little snacks. I had a cup of coffee, and then finally it was time to go back in. I went in and waited maybe about 15 minutes in the waiting room, and they called me back. I they had me sit down in the chair, the dentist chair, and the technician took the numbing topical stuff and numbed around my gums on the top real good. I should say whatever that is, that topical stuff that they used is very strong. So I'm really glad for that, because when the dentist came in to give me the Novocaine shots, and I was really, really nervous about that part, it did not hurt as bad as I remember it hurting at other dentists' office. So I think their numbing gel or whatever it is, I think theirs was really kind of superior to what I've experienced in the past. I was glad that she numbed me so quickly. The dentist came in and she's like, okay, I need to get you numb now. This is going to hurt a little bit. I'll try to go fast. And she did go fast. Really, really fast. It was like, she did, I think, 6 pokes. But she did them like quickly. It was like poke, 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 poke. And so the whole thing only took it was like less than 20 seconds, and I had my shots. And then, one of the shots kind of hurt more than the other, and I did let out a bit of a squeal, and she was like, oh, I'm sorry, one more, and then it was done. And she said to me, she's like, I knew that hurt, I'm sorry, we had to get that out of the way. And she said, I am going to come back and give you more shots, but you won't feel them the way that you just felt those. So, then, she left the room, and I sat there for maybe 10 minutes or so, I guess, while the Novocaine started working. She came back in with the technician, and she did give me some more shots, but she was right. I definitely didn't feel those the way that I felt like the first round of shots. And then she started kind of poking around with her little tools, and she's like, does this hurt when I do this? Does this hurt when I do this? Do you feel anything sharp here? And I didn't. I was numb. So then she started pulling. The teeth that were the most difficult to get out were the canine teeth, or the eye teeth as they're called. She told me that my roots were really pretty long on those teeth. But they did finally come out. It was funny because at one point she said to me, she's like, okay, you just have 2 more to go. And I didn't even realize that she had gotten the other 4 out. I thought she was still just kind of loosening them, but she had already gotten my 4 middle teeth out already. I didn't even know they were out. But anyway, so then, the tooth on the right, it was this one, took the longest. She really had to rock back and forth with those pliers quite a bit. It didn't hurt me. I felt pressure. When she was pulling, it kind of felt like my nose was going to come out with it, if that makes any sense. It was a lot of pressure, but it wasn't any sharp pain. After that, after both of my canine teeth were out and, everything was out, then she did the alveoplasty. She used some kind of tool and she did a couple little snips, and then she took a file and filed down the edges, I guess. But honestly, like, I was already like totally relaxed by that point because I knew if I didn't feel those eye teeth coming out, I wasn't gonna feel this, whatever it was she was doing. So, and I didn't. It was a weird sensation when she filed because it's very much like when you file a fingernail, that feeling, but it was here. So that was like it was a weird feeling. Didn't hurt at all though. And then she put in a couple of stitches on this side, and that was it. And then I sat there for a few minutes. The technician had to kind of awkwardly inform me that there had been a mistake made and my denture wasn't ready. So they loaded me up with gauze and made an appointment for the next morning for me to come back and get my denture, and that was it. I was on my way home. So it was really fast. It took less than an hour from start to finish. It was really quick, and I was out of there. I have to give big credit to my dentist because I was nervous, I was a little jumpy, and she did have to tell me repeatedly to keep my head still, stop moving away, etc. But she was very patient and very sweet about it. And I know for a fact that there are other dentists that would not have worked on me. They would have been like, referring you to the oral surgeon, I can't work on you, or, a lot of dentists just, they don't have any patience for, a patient who's nervous. But this dentist was really patient and really sweet, very good bedside manner. So, I'm really pleased. Other than the fact that I didn't get my denture right away, I would say it went really, really well. When the time comes for me to get a lower denture, or hopefully implants by that point, but when that time comes, I will definitely be using affordable dentures again.